Hey everyone, I am making another video because I am awful at keeping people up to date and I can never remember who I've told what. So I've got some good news and some not so good news. I personally am a bad news first kind of individual, so we'll start with the bad news. Since my last video, my health hasn't gotten any better. I'm still fainting multiple times a day. Most days I can't even stand without my blood pressure and heart rate skyrocketing ridiculously high. I now use a wheelchair or a cane with a seat, which gets me a lot of weird looks when I'm doing anything outside the confines of my apartment. I am still trying to get on temporary disability until my symptoms are more managed and I can get back to functioning and working, but at this point I've been denied twice because of my age, but I do have a hearing coming up later this month, so fingers crossed for that. I also can't drive anymore. Turns out they frown upon people losing consciousness behind the wheel of a multi-ton murder weapon. Who would have thunk? No, I get it. I really do. It's just, it sucks losing that, last iota of freedom. I can't go anywhere alone anymore except to take my dog out to go to the bathroom. And with the heat right now, I usually end up fainting either while we're outside or once we get back inside. So that's not super fun. As for health-specific updates, my primary care physician had set me up with a consult for a new cardiologist because my previous cardiologist had been awful time and time again, and just 0 degrees of helpful. The last appointment that I had with him, it was a video appointment. It lasted 6, maybe 7 minutes. All he did was change one medication because I asked him to, and then I told him about the testing that other doctors have set up for me. He didn't ask about, my fainting, blood pressure, heart rate, if I'm able to function at a basic human level. Nothing. He just hung up the call. But this new cardiologist has been absolutely wonderful, and I will get into that a little bit more in the good news portion of this. Back to the not so good news. A few months ago, I actually had a TIA, or a transient ischemic attack, which is basically a mini stroke, which was terrifying, but they are decently common among people who have hyperpots just because of the ridiculously high blood pressure spikes. I'm also getting a bunch of testing done for my stomach problems, but no official diagnosis yet other than reactive gastritis. I'm also getting tested for MCAS as well as a hypermobility diagnosis, possibly hypermobile Ehlers-Danlos syndrome, which is the least severe type of EDS, thankfully. And I won't go into too many details about that, but just for me, it causes constant bone and joint pain, as well as severe joint instability. I'm sure some of you remember back in school when I'd punch my kneecap back into place. Yeah, it turns out that's not normal. So I'm seeing an allergist, a geneticist, a gastroenterologist, and now the new cardiologist, and then of course my wonderful primary care physician. One of the tests that I had done for my stomach problems was a CT scan, during which they found lesions on one of my ovaries. So then I had to get an ultrasound for that, and that showed 3 complex hemorrhagic cysts on one of my ovaries. And prior to them even finding these, I had actually had 2 rupture already, which honestly was probably the most intense pain that I've ever felt. Which is saying a lot because I've broken just everything. But yeah, so that was not particularly fun. And I think really one of the most frustrating things for me recently has been how much I've been getting injured. Just in the last year, I've torn my bicep tendon. I nearly broke my jaw. I broke my nose. Just a bunch of ankle and wrist sprains. My knees and my hips are constantly subluxating. I'm constantly covered in bruises. It's very frustrating. But among all of that, I do have some good news. So thanks to my wonderful new cardiologist and her team, she has me set up with a neurology consult so that they can work together to find the best treatment plan for me. She also is having me do more autonomic testing to make sure there aren't any other autonomic malfunctions. And on top of that, she has gotten me started on IV infusion therapy for my chronic dehydration, which accompanies the POTS, which some of you knew. But I have actually also started at-home IV infusions, so I no longer have to go to an infusion center. And a nurse actually comes to me and they put the IV in for me, and then they leave, and then, when the bag is done, I take it out myself. And on top of that, in a few days, I'm actually getting port placement surgery. So once that heals, I'll be able to do infusions at home by myself. And I'm very excited to have a lot more freedom and hopefully be able to find some semblance of normalcy again. But anyway, that's the gist of the update. If you have any questions, feel free to ask, and I will do my best to answer them. I do, of course, want to thank everyone who has been supportive and checking in on me throughout all of this. It really hasn't been easy, and I appreciate all of the support and the understanding that people have been showing me. It really means more than I can express. So truly, thank you all, and thanks for watching.